Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is a career in medical coding or health information management expensive to maintain? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I got this comment that inspired today's episode. So I'm going to read the comment and then here we go. So the viewer says, these fees are making me rethink HIM in general. I plan on getting my RHIA and CCS certification, but I didn't realize how expensive the career field was just to get and maintain certification. So here's the thing, if you don't know, the RHIA is a Registered Health Information Administrator. This is a credential for those who have gone through a CAHIM approved program and gotten their Bachelor of Science degree in Health Information Management or Health Informatics and Information Management, right? Either one, okay? But it's approved through CAHIM. And you go, after you've completed your program, you can sit for the RHIA. The RHIA is for our leaders. You do not go to school and get a Bachelor of Science in Health Information Management or Health Informatics and Information Management to become a medical coder. You don't do that because that's not the concentration of that program. Now, before any of you gets fresh and says, oh no, my hospital, they only hire college graduates. That's a lie, because a lot of times when you see in these job listings, of course it's going to say, we'll take RHIA or RHIT, but if the person knows, they know that that's not what those degrees are for. And they will also say, candidate must also have a CCS, CCA, CCSP, or CPC. Because those are the medical coding certifications. There's a difference between the credentials, okay? So if you have the RHIA, that is saying to somebody who understands in the industry that you are a leader, that you want to be in leadership. Now, if you say, well, no, Blue, that's not what I want to do, because my recruiter said this or that. Your recruiter is meant to recruit. And so sometimes people are sold this career field. They're not told all the details, because it is your responsibility to look up those details. No one is going to make it easier for you, and no one is going to say all the hard things, because then people would not sign up for these programs. They would not sign up to get medical coding classes and things like that. They wouldn't do that because they don't know that, hey, you have to know basically what a doctor knows while never having gone to medical school. Even though we don't touch patients, we still have to be able to read and interpret documentation that is written by people who have education for a decade plus. And so because we have to read this very complex, very comprehensive documentation, we have to be up on our game. And if you say, well, they didn't tell me this in the school, I'm telling you so that you can be prepared. Now, my way of saying it may not be what you want to hear, but again, it's not about what you want to hear. This is the reality. This is the truth. This is actually what happens. And I have nothing to sell you as far as, before any of you, oh no, Blue, as far as a school or credentials or anything like that. I'm trying to explain to you this. Okay? So if you have that RHIA, it's because you want to be in leadership. And then if you get the CCS, that means that you have the mastery, because that's what the CCS is. That is a mastery medical coding certification. This says you have mastered both inpatient coding and outpatient coding. There is a big difference between the two. And when you have that, this says that, okay, a person who has an RHIA and a CCS is somebody who can settle arguments in the department, is hopefully leading the department and the health information department. So those are things that somebody with those two credentials would do. If you are not doing that, then you are not working at the full potential that you could be just having those two credentials. Okay, I'm just saying, it's not an insult to you. It's just that sometimes people just don't know that that's what this is. And some people say, well, I would feel better to have a college degree so that I know everything. But if you're not really using that college degree, then why did you get into debt for it over? Now, if you were in a program and somebody paid for you to get that degree, then that's something different. Then you just got really lucky. But you still want to maximize the full potential of having that certification, which is leading a department and leading people, or becoming an auditor or becoming an educator, those types of things that you can do with that credential. So with that said, the fact that this person says, well, all these fees, this is an intellectual field. Health information, medical coding, the revenue cycle, medical billing, this is all intellectual. While medical billing is a lot about processing the claims and things like that, medical billers still have an ethical responsibility to understand what it is that they're submitting. If they say, no, well, we are just submitting whatever the doctor said. Okay, well, here's the thing. You're still the one that's submitting those bills. So when it comes time that if something happens, you're going to get questioned as the biller. Why did you do this? If you know that this is not the correct thing, or if you heard about something or whatever, or you didn't see the appropriate documentation to support this, why did you submit the code? So that's the thing. We all are ethically responsible to understand what it is that we're doing. So anytime that you are in an intellectual field, whether it is being a doctor, doctors have to have CMEs, right? And then lawyers have to have CLEs. We have to have CEUs. Nurses have to have whatever it is that they have to have for their continuing education as well. So any career field that you get into, there's always going to be an association where sometimes you have the option of paying the association so you could be a member, and sometimes not. And there's benefits to being a member versus not being a member. With this person that they're saying that they want to have the CCS and the RHIA, this is somebody that wants to be with the American Health Information Management Association. With the American Health Information Management Association, you have the choice of being a member of the association or not. You don't have to be, but there are benefits to being a member. They give you access to the job board. You get discounts on reporting your CEUs and things like that. And there's lots of other benefits that they have to being a member. You get all kinds of other discounts on their books and things like that. So because we have to continually educate, this could be a good thing. And there's 2 levels of membership as well if you have the standard membership, right? I'm not talking about the student membership, because that doesn't really count in this conversation. I'm talking about, like, they have your standard membership, and then they have the professional premier, which is a little bit more expensive, but you get a little bit more benefits with it. So, but that supports the association. The unique thing about the American Health Information Management Association is that they work with the government to advocate for health information. They're also a part of the cooperating parties that look over ICD-10-CM and, of course, ICD-10-PCS. So they're the ones that do all of that. They're very hands-on with that side of the house. And we need that. We need that in this industry because they are the leader. The American Health Information Management Association has been around for a very long time. Now, of course, there is the American Academy of Professional Coders. That is another organization. But this AAPC, the American Academy of Professional Coders, is a for-profit organization. So their business model looks a little bit different. They actually require their people to be members every single year. And their membership fee is $222. AHIMA's is not that. Okay, it's less. So, but they require their members to be everybody has to be a member. If you carry their credential, the CPC, or any other conga line of credentials that they offer, but the CPC is their flagship credential with AAPC. And you have to get 36 continuing education units to maintain one certification. The more you get, the more CEUs you have to get in order to maintain those credentials. And with some of those credentials, you have to have certain vendor certain vendor CEUs in order to maintain your certification. Like for the CPMA, it has to be certain vendors in order for you to be able to maintain that credential. So that's the thing you have to understand. There's a difference. With AHIMA, if you have the CCS, the CCA, or the CCSP, and you just have the one, it's 20 CEUs, okay, for your reporting period. 30 versus the 36, you have 20, okay? Now, if you have this, like this person says, the RHIA and the CCS, if you get both of those, your CEU requirement is 30, which isn't bad, okay? So that's the thing you have to understand. So if you say, well, Blue, I don't know if I can afford the membership. So that's part of why we get paid well. Now, if you do not get paid well, or if you say, well, I don't make enough money, that's really on you, because there's places that understand what coders do, and there's places that do not understand what coders do, and they're going to try to get you as cheaply as possible. Did you hear what I said? There are places that will not pay you based on your knowledge because they don't understand what we do. They just know they need somebody to process the paperwork. And they think of you, the coder, as a biller. So they're going to try to pay you as least as possible. When, again, if you have the knowledge and the skill, you can go anywhere. You can literally go anywhere, and you can write your own ticket. But, again, there are people, well, I've been working here, and I can't afford this, I can't afford that. If you have the experience, and you have the knowledge and the skill, you can go anywhere. And it's the same thing for my new folks that have no experience. Well, everybody wants experience. Well, they can want it. They can put want in one hand and you know what in the other, and see which one weighs more. These employers are always going to say that they want experience because they don't want to have to train, because there are these fast-paced medical coding programs that they'll promise you we can get you on your way to being a brand new medical coder, making all this wonderful top dollar money in just 4 months. Heaven forbid 2 months, but there are some people out there that are like that. Some schools. Whatever. You can't learn this in 4 months or less than 2 months. You cannot. It takes 9 months, 12 months, or 18 months to learn in order for you to get the full understanding. And that includes you, my nurses, okay? It includes you too. Because even though you have all of that anatomy knowledge, medical terminology knowledge, it does not mean a hill of beans if you cannot understand the guidelines, the sequencing, when modifiers apply, what about evaluation and management. If you cannot do that, all your nursing knowledge means nothing. And it's not an insult to you. It is just the truth. There's a lot of people out there that are trying to push and sell medical coding to nurses in particular. And it really upsets me because I feel like a lot of nurses get taken advantage of because of that. But then they play to their ego. Oh, you're a nurse, you can do this. And then I'm the one who gets messages from nurses that says, well, Blue, I didn't take it as seriously as I should have, and I failed my test. What do? I need tutoring. So then we set up tutoring. So that's the thing, guys. It's not easy like people say, because this is an intellectual field. You do have to pay in order to be in this industry. But the great thing about this industry is that if you find an employer who will sometimes pay for your CEUs, with my employer, I get free CEUs. I get 10 free CEUs every year from my employer. 10. A minimum of 10. Sometimes we get a little bit extra depending on what's going on. But then I'm also a member of a HEMA. So I get free CEUs with my membership as well. So I have more than enough to pay for to gather up all my CEUs that I need for the 2-year reporting period. Okay? So that's the thing. It depends on where you are. If you're already nickel and diming, oh, I can't afford this, I can't afford that, this is not the field for you then. And I will just be straight with you. That's the truth of it all. Because again, this is an expected part. You're not going to get into this and not have to pay nothing out. You will, whether it's for your test or sometimes for your CEUs, it all depends. Now, as far as the membership fee, with the HEMA, it's an option. But if you do not pay for your membership, well, then your fee for maintaining your credentials is going to be a little bit higher than somebody who does have the membership. Okay? But that's, again, there are some companies that will pay for your membership. I worked for a level 1 trauma hospital a few years ago, and they paid for my membership with the HEMA, which was fantastic. I just paid it, and then I submitted the receipt, and they reimbursed me. So there are companies out there like that. that will pay for your membership with the association. And like I said, with your employer, it's a benefit of the employment sometimes to get CEUs. And for some employers, they give their employees a stipend in order so that they could pay for whatever CEUs they want to. So some of them will go online and take courses and stuff like that. HC Pro has a lot of really good online boot camps. A boot camp is 60 days, just so you know. There's no extensions with these boot camps. And so if you're really serious, and you can earn a lot of CEUs all in one sitting, some of them are a little pricey, but I've gone through a couple of their boot camps and it was fantastic. I learned a lot. I went through their ICD-10 PCS course, and then I also did the the CDI course. So that was pretty good. It was pretty good. So I highly recommend that. There's other ways of getting CEUs. Sometimes your employer will pay for you to attend conference. Every year we have a national conference with AHIMA. AAPC has theirs also as well, and theirs is throughout the country. You know, we have with AHIMA, we have ours. Every state has their own. They have their own statewide conference. So if you don't want to go to the national one, you don't have to. So people go to the statewide conference, and then they also attend the national one. This year is going to be in Minnesota. I will not be attending. So, but if you are in the area and you're interested, it's a great experience. And if you already have your credentials, it's a great way to rack up a lot of CEUs, because for every seminar that you attend, you get CEUs for attending. Okay, so there's a good way to collect all your CEUs that way. But don't look at this as, oh, it's all these expenses and it's expensive. It is, but if you're making more money than you were before, that's why. Think about that. This is a much more expensive field. It takes money for these associations to do what they do, whether it is with AAPC recruiting more people and making the company bigger, or if it's with AHIMA, the money that it takes to go and fight on Capitol Hill and to go do all of these things with the laws and things like that, and being very proactive with those things, that all takes money. It does. It takes a lot of money. So however these associations handle their funds, I have no say in that. But I do know that that's part of what they do with those funds. Okay. So, but that's what you need to know about this career field. Don't act shocked, guys. Don't act shocked. And again, if you're like this person, and I have a feeling that this person went all the way through their college program and had no idea about this, it is your responsibility. No one's going to hold your hand. No one. And I'm not saying that to be mean. A lot of y'all lately have just been taking everything I say so sensitive. This is not to be mean. This is to be very direct, and this is so that you all know that no one is going to hold your hand, and no one is going to try to make this easier for you, especially if you're not doing your research in return. Now, if you've been in this program this whole time for your college degree program, and you did not know that you need to get your RHIA afterward, either that's a very poorly run degree program, or you weren't paying attention. And I'm thinking that it's the latter, because they tell you repeatedly throughout your program. The people that are in these health information management programs, these professors that are doing these courses, they're telling you repeatedly that this is what you're going to go up against when you get done with this program. That is not a hidden fact. And again, if you're not paying attention, you're not paying attention. But you knew enough to know that you wanted the CCS. Why don't you want the CCA? Why don't you want the CCSP? Why do you go after the CCS? Because you know it's the gold standard. Okay, so you knew about that. I'm just saying, you know. So with that said, any intellectual field you get into, whether it's nursing, being an attorney, being a doctor, being a medical coder, we all have to have these continuing education units in order to maintain our certifications, in our cases, licensure with doctors and attorneys and nurses and things like that. Everybody has to put money into the industry. And that's what keeps the industry going. It keeps the promotions of the industry itself and the associations, which is very important, because otherwise these associations will just fall away. If there's no money to maintain these associations, there's benefit to these. You get community with these associations as well, because again, you're learning from each other. You can take advantage of your membership, okay? But if being a member of something and having to do all of this is not your cup of tea, well, there's other career fields, but you're always going to have to pay something. Somebody's going to have their hand out somewhere. I'm just saying. So with that said, let me go ahead and wrap this one up. But yes, don't be surprised, don't be shocked. But I will say this though, you can control the amount of money that you have to spend. You can control the amount of money that you have to spend, because you do not have to rack up all of these credentials, and you do need to know what you have and what you're getting and what the purpose of that credential is for. If this person does not want to be in leadership, do not get the RHIA. If you want to be just a coder, then just get the CCS. If you are with AAPC, you get their flagship credential, the CPC. You do not need, if this is your first year in medical coding and you have no experience prior, you do not need to get the CPB, CRC, CPMA, all these other credentials, because you don't have the experience to back it up yet. The more credentials you get, the more you're going to have to pay in fees for taking the test. The more you're going to have to pay in order to maintain those certifications. And then if those certifications require specific CEUs from certain vendors, then you're making yourself spend more money. You only need one. You do not need to compete with Sue, Jane, and Sally, and Henry, and Hector, because they have all of these credentials and I want to be just like that. But you know what? If you two get the same job, start at the same time, you're getting the same amount of money. And who is having to spend more? All these other people and not you, if you only have the one certification. And I had one certification for 13 years. One. I had the CCA for 13 years. That was my only certification. When I started my YouTube channel, I started with the CCA. I would still have it today if AHIMA would let me, but they don't. Because the two certifications that I have now outrank my CCA. But that's okay. That's okay. But you are also in control of saying yes to more credentials. You are also responsible to know what it is that you're adding on to your name. Do not add something to your name that will not benefit you. Well, it'll help me get a job faster. No, it won't. No, it won't. Because I've seen people with a string of credentials on their name who cannot code to save themselves. Cannot explain basic things about coding, barely know about evaluation and management, and yet have the nerve to brag, oh, all you have to do is just study just a little bit and you can pass these exams. Passing an exam means nothing. I would trust the person who has one certification over the person with a string of credentials after their name that doesn't really mean anything if they don't have the experience to back it up, if it is not unique to their coding certification. I wouldn't trust those people, because now you're just showing off for what? If these are for different things and you've mastered different things and you can do different things, absolutely, all for it. If you have the experience to back it up. But if you don't, and you have been in the industry for less than 2 years, no. It's ridiculous. It's ridiculous. But there will be people who will do it. And, oh no, I just wanted to do it for me. No, you didn't want to do it just for you. You want to do it because you want people to think that you are ready and competent and all these things. And while some may be, because there's always those that are really excited when they get into it and they get it. It clicks for them. The vast majority don't. And you're wasting money. Okay? So I don't want y'all to waste money. I want y'all to concentrate on learning. And that's what you should be doing in these first 2 years. But again, what do I know? What do I know? So with that said, I'm going to go ahead and wrap this one up. But thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.